Well, welcome back, everyone. Today, we are shining a light on vein health and the in-office treatments that is available at Lima Memorial that can make a big difference. Now, here with us is Dr. Jeremy Heffner. He's a general surgeon with Lima Memorial Health System surgical specialist. So, welcome, doctor.
Welcome.
Yeah, so, Dr. Heffner, what are some of the most common vein problems that you see in patients?
Yeah, veins are one of those things that's rarely discussed in medicine, and a significant portion of the population as we get older are going to have symptoms consistent with vein issues. What you're typically going to see, and if you look around the population, you'll notice this, leg discoloration. So when you start to get that kind of bluish tone that becomes a red color on your lower legs, that's actually a sign of a vein problem. And more commonly, what people will talk about is swelling. So if they have swelling where one leg especially is worse than the other, I mean, sometimes it's both legs the same, but generally if you have one leg worse than the other, it usually means that you're having a vein problem, where the fluid is going backwards into the system, into your feet, causing them to swell. Other people complain about heaviness, fatigue, frequent cramps. All of these can be associated with vein problems. And the reason they're underdiagnosed is it happens slowly over your life. So by the time you turn 60, 70, you've gotten used to it and you think it's just your legs are getting older. But the reality is it's something that is treatable and it just needs to see the right person.
All right. So what types of in-office vein procedures that do you offer at Lima Memorial?
We actually have a comprehensive approach. So we're one of the few that we have multiple different modalities or different ways of treating these. In the end, they offer the same final treatment, which is to close the veins down that are bad. What you really have is a short circuit in the system, and we have to go analyze the entire leg, find all the veins that aren't working properly, where the short circuits are, and then we go in there and we actually fuse those closed so the blood doesn't flow the wrong direction. Those veins aren't being used to get the blood back to the heart, they're being used to get the blood to the foot where it's not belong. And so we need to go through there, find those places, then use one of the different tools we have to close those off so the blood only goes in one direction, which is back to your heart.
Wow, interesting. So how quickly can someone get back to normal activities, especially after these procedures?
After the procedure is really quick, actually. So once we get through the process with insurance, which is what takes the longest part of the time, then we can do the procedure. Same day, you basically walk out of the office. You go back to generally normal activities. I don't want to run a marathon or swim in a river or something. But generally speaking, up, walking, talking, right after we're done. And you just have to wear the compression hose that we give you.
Okay. So how do you decide which procedure is right for a patient?
It's going to be a evaluation process. So first you have to come in, we have to talk to you, see what kind of symptoms you're having. The insurance companies will require a waiting period where we have you wear compression hose for some period of time. Then we bring you back. If those work for you, then we continue down that modality or that treatment therapy. But if those aren't doing enough, you're still having symptoms, then depending on how many veins we have to do, what veins we have to do, that's how we decide which way we're going to do it. And we have a conversation about that.
Okay, so if someone wants to reach out, and especially if they're interested in learning more about or scheduling an appointment, how do they do that?
It's very easy to call our office, and we'll get you in for the first ultrasound and start mapping your legs so we know what the problem is. And then you and I will sit down and have a conversation. We'll talk about what's going to work best for you.
All right, well, fantastic. Well, doctor, thank you so much for joining us today. I really appreciate it.
Always a pleasure.
Well, don't go away because we have more to be returned.